Hello, I'm Dr. Eugene Chio, an otolaryngologist at Ohio State Wexner Medical Center. As you all know, CPAP is an effective frontline therapy for sleep apnea patients. However, for a variety of reasons, some patients are unable to use CPAP successfully. These patients remain vulnerable to heart and brain health issues, accident risk, and diminished quality of life. Upper airway stimulation is a treatment option intended to help some obstructive sleep apnea patients who are unable to use their CPAP. It's a small device inserted in the upper chest during an outpatient surgical procedure. Patients use the sleep remote to turn therapy on when they go to bed and off when they wake up. The system collects therapy information, including objective adherence data, to help physicians optimize both comfort and effectiveness of the therapy for their patients. Upper airway stimulation received FDA approval in 2014, and to date, over 2,000 sleep apnea patients have been treated with upper airway stimulation. Ohio State is one of the leading medical centers offering upper airway stimulation therapy as part of its sleep apnea treatment program, and the only one in Central Ohio. This animation shows how upper airway stimulation works. When the muscles and soft tissues of the throat relax and block the airway, the device delivers mild stimulation to the hypoglossal nerve, which controls the muscles and movements of the tongue, stabilizing the upper airway and improving airflow. Since it's a motor nerve, the stimulation is delivered with very little sensation to the patient. The distal branches of the hypoglossal nerve control two important airway dilator muscles, the genioglossus and the geniohyoid. Targeted stimulation to this portion of the hypoglossal nerve activates these two muscles, which gently push the tongue forward to open the airway. These sedated endoscopy videos show airway patency in response to stimulation. On the left, stimulation is off, and you can see the airway obstruction at both the tongue base and the palate. On the right, mild stimulation is delivered during the inspiratory phase of the breathing cycle. The stimulation significantly increases airway patency at both the tongue base and the palate, creating a multi-level effect.